first responders, they're tough individuals. They go through a lot, and somebody like myself who doesn't go through that on a day-to-day basis, I can't imagine what they endure. But I know, you hear the stories on TV and you see it, what they go through and that impact and how that wears on their bodies and stuff and wears on their minds. And so, whether it's responding to a fatal car accident or, a house call, things like that, you just don't know what they're enduring on a day-to-day basis for work. And so what this does is it provides peer support. And so it's not saying, okay, hey, you endured a traumatic event, now you need to go see a therapist, but it might be somebody alongside them, a coworker that kind of goes through those same things and kind of sees that, and kind of on that same level, that they're able to connect and talk to them and maybe provide that support. And if they need further counseling, they're able to walk them through that, kind of give that warm handoff to support. And so it's not just saying, hey, you need to see somebody, or hey, hoping that they take that initiative themselves. It's really breaking down those barriers to getting support.
This has been a huge need. Like the chief said, that has been nothing in the area, and with law enforcement, fire, EMS, corrections, dispatch, all those that are first responders, the incident rate of self-harm has gone through the roof, and so this is just something where somebody can pick up a phone and just call someone that's a peer, whether it's law enforcement, fire, EMS, and they've got somebody they can talk to, even if it's just to talk about the day. And then we've also got resources that we're slowly building up to be able to refer them on to someone if they need to speak with somebody, mental health professional. This is probably the greatest thing about this, is that it's peers. It's people that do the same job that they're doing. They know the stress, they know the job, they know all the things about the ins and outs. And so, when someone calls and has just had one of those calls, it's tough to handle. They know that they're going to get somebody that's been there, and they can talk to them about it.
Now, you had training you had to go through.
Yeah, we've had 3 full days of training, and then we've got more training coming up. And we're not mental health professionals, and that's not what we're trying to be. And that's they understand that when they're calling, that we're not mental health professionals, but we truly are just peers that know how to make sure that they're doing what they need to do to relieve the stress. So it's not going home to family. It's not, it's something that they can leave at the door. And if they need help with that, then we'll have the resources to be able to send them to somebody that can help them with that.